Next, we are going to go over the nose. We will start with the general description of the nose. The nose is the prominent organ of smell located in the middle or center 1/3 of the face. It is also the beginning of the respiratory tract, and it's triangular or pyramidal in shape. Racial and profile classifications of the nose. There are 3 racial classifications: Leptarhine, Platyrrhine, and Mesarhine. Leptarhine is a classification given to a nose that's long, narrow, and high-bridged, common to individuals of the Western European descent. Platyrrhine is a classification given to a nose that's short, broad, and has a minimum projection, typical to individuals of African descent. And Mesarhine is a classification given to a nose that's medium broad and medium low, predominant among people of an Asian descent. The 3 profile classifications are straight, convex, and concave. The straight nose is associated with Grecian. It's characterized as straight from root to tip. Convex is characterized as Roman or hooked. It's curved as in the beak of an eagle, or hook-shaped when you view it from a profile. And last is concave, also known as a snub nose, pug, infantine, or retrousse. It's characterized by a dip in the bridge and turned up at the end. All right, we're going to go over to the anatomy and parts of the nose. These are all of the different names. I'd rather go over this with the photo of the nose in front of you so you have a little bit better idea of where these things are. The nasal bones are not viewable in this photo, but they are the paired nasal bones inferior to the glabella. We know the glabella as being right here, forming a dome over the superior portion of the nasal cavity. The nasal cavity is the orifice in the bony face, bounded by the margins of the nasal bones and the maxilla. Nasal spine of the maxilla, the sharp bony projection, located medially at the inferior margin of the nasal cavity. It indicates the bony length of the nose, right here. The major cartilages are the septum and superior lateral cartilages. And then as far as the structure of the exterior nose, we have the dorsum. That's going to extend from here to here, from root to tip. The root is going to be the base of the nose, where my glasses are sitting. And the bridge is the dome over the nasal cavity, the point of greatest projection, the arched portion of the nose that is supported by the nasal bones. Next, we have the wings, which are viewable in this photo. The wings are the lateral lobes of the nose, right here. It's the widest part of the nose, bordered by the nasal sulcus and the anterior nares. The columni nasi is next, which is the fleshy termination of the nasal septum at the base of the nose, located between the nostrils. So that's going to be seen right here. The anterior nares, as we know, are the external nostril openings. On the sides of the nose are the lateral walls. Lateral walls of the nose located between the wings of the nose and the bridge. They recede laterally from the dorsum. So that's going to be where the bottom of your glasses sit, right here on your nose. And protruding lobe of the nose is a rounded anterior projection right at the tip. Okay, next we'll go into the nose restoration and physical and pathological distortion. So nasal restoration is defined as a state of being twisted or pushed out of natural shape or position. Different things can cause this distortion. Some of the causes are going to be cancer, superficial pressure, fracture of the nose, and erosion due to the feeding tube. So for cancer being the first reason for distortion, the treatment would be temporary sutures that can be used to hold the nose in place during embalming and then removed after embalming before your waxing and restorative art. Superficial pressure is going to be the second reason for nasal distortion. Superficial pressure can be caused by the body bag or any sort of covering that's going to be on the decedent, causing pressure to the tip of their nose, making it distort. The treatment for this could either be mortuary putty or cotton that can be placed into the nose during embalming to reposition or it might be as easy as just using some massage cream. For fractures, the treatment is going to be to reset the nasal bones into an appropriate position and embalm as normal. With a fracture, you're also going to want to be aware of leakage during embalming. During the fracturing process, some stuff in the face might have been compromised, causing leakage during embalming. And last is erosion due to feeding tube. If a person had been given a feeding tube that was inserted before death and had been there for a very long time, there's going to be some structures inside of the nose that could have potentially eroded or caused any sort of necrosis. If there is necrosis, you're going to want to excise the necrotic tissue, clean it, dry it, and restore it with wax.